Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. This is episode 72 of the Lean Blog Podcast for August 14th, 2009. We have a returning guest today. He is Dr. John Toussaint, CEO emeritus of ThedaCare, and currently the CEO of the ThedaCare Center for Healthcare Value, which is a not-for-profit that's a partner with the Lean Enterprise Institute in what we call the Healthcare Value Leaders Network. Today we're going to talk about John's role with the ThedaCare Center and public policy, the work he's been doing in Washington, educating leaders about the potential, the reality of what's actually happening with Lean, and what that can lend to the healthcare reform discussion. As always, thanks for listening.
Well, again, I'd like to welcome back to the Lean Blog Podcast our guest, John Toussaint, the CEO of the ThedaCare Center for Healthcare Value. Thanks for coming back.
Thank you, Mark.
So we're going to talk today, I think it's a natural evolution from the previous podcast where we talked about the Lean journey at ThedaCare, and we talked previously about the ThedaCare Center for Healthcare Value. So I was wondering if you could update the listeners on what's happening with the ThedaCare Center and the partnership, what we're working together on with the Lean Enterprise Institute.
Well, one of the main activities of the ThedaCare Center for Healthcare Value is to accelerate the application of Lean transformation in healthcare across North America. So, what we have decided at the center is the best way to do that is to go with the experts and create a partnership, and so that's why the Lean Enterprise Institute, led by Jim Womack, and the ThedaCare Center for Healthcare Value have come together to create a partnership that is actually facilitating the Healthcare Value Leaders Network, and our goal is to bring together healthcare organizations who are focused on implementing continuous improvement using the Lean methodology and sort of accelerating their learning curve by having them be able to share and learn together. So this network, healthcarevalueleaders.org, you can actually go on the internet now and start to see what we're doing. But our goal is to basically do a few things. The first is a Gemba learning process. So we have are conducting structured visits to each member site where we actually have a very specific goal in mind of using leveraging what the member has learned on their journey for the other members. Our first Gemba learning visit was at ThedaCare in June, and we had 50 people here to actually learn about Hoshin planning, or in the Toyota production system terminology, policy deployment. So we spent 2 days in a deep dive learning activity using Gemba as the way to learn. The second thing we're doing is around measurement. We need to be able to create a set of consistent measures that actually measure value creation, and this is a very complex task, but what we want to be able to do is compare network members' performance across all membership in an apples-to-apples comparison fashion. The next thing we're focused on is assessment. So what we want to be able to do is actually have a third-party assessment of each organization to say, this is where you are in the Lean journey. Here's the gaps. Here's the things that you ought to be focusing on for the next year or so. And then we'd be able to do these assessments on a regular basis, maybe yearly or every other year. And we're actually working together with the Shingo folks at Utah State University to develop that. And then what we're interested in is to try to make as much of this virtual as possible. So you, Mark, and LEI staff are putting together a state-of-the-art sort of virtual education center that will be for members only on the Healthcare Value Leaders website. And so members will be able to share, blog, Twitter, whatever they need to actually look at what they want to learn. And then the final thing we're doing is public policy work, and our goal is to get legislators from many states, because these members come from many states, to understand what we're trying to do and to support us to actually reform all of healthcare in the United States.
So on the public policy front, I know you've been spending time in Washington and working with leaders at different levels. I wonder if you could talk a little bit about what you think is missing in the current healthcare reform discussion. How does that tie into lean and healthcare value and some of the things that you're working on?
Well, it's interesting because I have spent a lot of time with legislators, and I think they have the lingo right. They talk about value and quality and cost, but the problem is they don't have a clue about how to write legislation that's going to actually drive better value in healthcare. Waste and waste reduction, and how do we incent organizations to take waste out, improve quality, and lower cost? A good example of how broken the system is at the moment is the ThedaCare's work on collaborative care, which is the radical inpatient redesign that we created using the lean principles. And we've shown dramatic reductions in cost, about a 25% reduction in total cost of care, and about 100% reliability of quality performance indicators, but yet Medicare pays us $2,000 less per case on a patient that is in the collaborative care unit than a patient that's in one of the traditional units. So, at this point, all of the bills that are on the table in both the Senate and the House do not address these sorts of issues. So if we don't start to work on the fundamental issue of waste reduction in healthcare, which is obviously what lean is all about, and many of us have proven it's about that. We're really going to only add $1 trillion to the already $2.5 trillion healthcare system without any hope of actually reducing the total spend over time.
So what do you think the potential is, or what have you been trying to educate the legislators about in terms of actually reducing waste, improving quality, the impact that you think that would have on cost at a national level?
Well, let's just go back to that one example I mentioned. I mean, if we could reduce by 25% the cost of inpatient care across the country in our hospitals, that would be a $400 billion savings over 10 years. So, that's the magnitude of what we're talking about. The Gunderson Lutheran folks have done a lot of work on end-of-life care. They've done a lot of work using some of the lean principles on their inpatient work as well. It's half as expensive to take care of a Medicare enrollee in La Crosse at Gunderson Lutheran than it is than the average Medicare enrollee in the nation. Half as expensive. So if we all were able to do it at that level of efficiency, take care of patients at that level of efficiency, that would actually equate to about $2 trillion savings over 10 years. So with two examples that are real-life examples, this isn't something that's being made up, we've got $2.5 trillion of savings over 10 years. So what we're trying to hit home is that there are some communities where this work is being accomplished. Let's incent and reward and take the barriers away so that people can innovate using the lean tools and improvement activity, so that we can start to get the cost out. Because we can. We know we can. We've proven it. And many of the organizations that have signed up for this first Healthcare Value Leaders Network are doing this in their own marketplaces.
All right, and if we can step back to people who aren't familiar with the collaborative care model, or I think some of the true process improvements and true waste reduction that's taking place at ThedaCare and Gunderson Lutheran, which is also there in Wisconsin. I mean, it seems like a lot of the debate or the discussion in the public when we talk about reducing cost involves things like just paying less, or when people hear about shorter length of stay, they might have that old mental model that, well, you must be just pushing people out the door too soon, or that it's a fake efficiency of sorts. Can you maybe talk about how those improvements incorporate lean principles and how it's really what you might consider like a true cost savings without harming quality?
Yeah, most when we have studied the process of inpatient care, the reason that we've been able to reduce the length of stay by about 20% is that we have taken the waste out of the process. In other words, patients aren't waiting for 12 hours to get a CAT scan, for example. If they need a CAT scan, they get a CAT scan when they need it. So if it's determined that the CAT scan is needed at 3 o'clock in the afternoon, they get the CAT scan at 3:30 or 3:15 instead of waiting till the next morning. That's a very simple example. Now, it doesn't mean that patients are necessarily 100% back to normal when they are discharged from the hospital. But what we're able to do is connect the entire value stream for that patient condition, so they can get the needed care that they need either at home with home care, nursing, or in a step-down unit or in a nursing home, which is a much safer place, particularly home, than the hospital. So we don't just push them out the door and say, good luck. Actually, the readmission rates for these conditions in collaborative care have dramatically dropped as well, in some cases as high as 50% reduction in readmission rates, because we're doing the right things, all the right things, using a set of criteria that have been established that each patient must move through a series of toll gates and have to actually meet those quality criteria before they can move through the final toll gate, which is discharged to home. If they haven't met those quality criteria, then we do a PDSA to understand why, a Plan, Do, Study, Act cycle to understand why, until we get it right, until we get the quality right. So quality is really built into the system within this redesign.
So I think you're right that there's a lot of shared language, there's shared goals that are things that are compatible with Lean and what you're trying to do and what the network is trying to do in terms of improving quality and reducing cost. You mentioned readmission rates. That's something I know President Obama has brought up many times as a goal and something we need to do. And here I think here you are with Lean and with a method to actually make those goals a reality and not just be a target or a goal. How do you find that there's still a gap that you need to bridge in helping our political leaders understand that yes, there's actually a method, or B, what can the legislators do to actually help promote some of the improvements that you're talking about?
Well, I think the number one thing that legislators can do is stop paying for volume and start paying for outcomes. So what we want to do is pay for outcomes of care. And one of those outcomes is people don't end up back in the hospital with the same condition. And another outcome is that we have fewer hospital admissions for complications related to chronic disease. And another outcome is we reduce the total spend, the total amount of money spent on chronic disease patients, because we're able to prevent these complications and problems by doing the right thing in an outpatient setting and having the right resources designed in a one-piece flow for the customer, which is what we have learned using the Lean principles, so that the patient is receiving exactly what they need when they need it to prevent these horrible problems from occurring. Now, if we continue to get paid in the same widget payment system, which means right now when a patient comes in the hospital we get paid, what we really need is a system that says if patient comes into the hospital, that's a failure, and we shouldn't get paid. And as soon as hospitals don't get paid for admissions, we're going to see significant improvement in population health and in the overall cost of care.
Mm-hmm. So it sounds like what you're saying is if the right payment incentives can be put in place, then that will help provide incentive for hospitals to do the right thing and then hopefully discover lean as a process for making that happen?
Exactly. I mean, we have a proven methodology now in healthcare to dramatically improve quality and lower costs, and it's called lean in healthcare. It's not, we don't use a lot of the jargon that manufacturing uses. There are different processes in healthcare than there are in manufacturing, but it's still a process. These tools still apply, and they work. ThedaCare has proven it. Gunderson Lutheran has proven it. Group Health of Puget Sound has proven it. McLeod in South Carolina has proven it. I mean, we're proving it all over the country, so it's not just some isolated place. University of Michigan, and on and on and on. And so we know this works. What we need to do now is to create the incentives so that we all have, the right financial pieces in place to do what we know works the best for our patients.
And so you're out, spending a lot of time now working with and visiting a number of hospitals within the Healthcare Value Leaders Network. If to kind of wrap up the discussion here, if you could talk a little bit about, again, how this network is helping support some of these goals of, reforming healthcare delivery, and if people want more information or to get involved or to talk about that, what people listening might be able to do.
Right. So this first network of organizations is not in any way meant to be exclusive. It's just the first group that said, gosh darn it, we're going to do something different. We want to come together and accelerate our learning process. What we at the Center and LEI are doing is to say we want to facilitate as many of these networks as want to form. And so we're here to help make that happen. So what I would suggest is that anybody that's interested in actually getting involved in one of these deep dive learning networks, they should go to the healthcarevalueleaders.org website, and there's a place that you can actually apply to get more information. Now, we do have a set of criteria that we've established for organizations that are interested in joining a network. And so the first thing we want to do is do a phone interview with those folks. And so either LEI or the Center will conduct that. The criteria at this point are to have at least a year or so of lean activity and some progress in that you have the senior executives committed to using lean as a method of continuous improvement, that people are willing to participate and share their work with others in a network, and that again, we're going to have a diversity of organizations here. So we might have some that are on 5 years on the journey. We might have some that are 8 months on the journey. But it's this concept of learning from each other and being willing to share and work at it that we're interested in. And so if folks meet those criteria, our next network planning meeting for new networks is in Chicago on November 3rd and 4th. And so if interested, you should let us know as soon as you can, because that date comes up faster than we ever believe. So that's sort of the process that we're asking folks to go through at this point, Mark.
Okay. Well, thanks, John. Thanks for sharing some of your thoughts on the network and for talking about what's going on or what's not going on in D.C. and on the public policy front, depending on how you want to look at it. But I'm glad you are out there working on that, educating our leaders about lean and the potential, and not just potential, the reality of what's happening at places like ThedaCare and so many other hospitals across North America, as you pointed out. So I want to thank you for joining us. Hopefully we can chat again, either as the world is changing here on the healthcare reform front, or maybe even to share more of your experiences and examples from the lean journey at ThedaCare. I think that would be great.
It's been my pleasure, Mark. I look forward to it again.
All right. Thanks.
Thanks for listening. This has been the Lean Blog Podcast. For lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.